servant. I work at the Department of Health, and I suppose I provide that professional leadership role across the whole sector. So, not just for the registered nursing workforce, but that wider workforce as well. So I'm really delighted to be the first, and coming into this role in that second half of the challenges around COVID, focus on that, and then since then tried to develop the role and actually the workforce issues for social care and get it on the map.
Just explain then who you work for and who you work with.
So, like I say, I'm a civil servant, so technically my role is to support the government of the day, regardless of what that political muster is. So that's the role of the civil servant. That's what we do. My line manager is Michelle Dyson, is the Director General for Social Care. So I sit in the social care hub of the Department of Health, but of course nobody works in isolation, and because I have that professional lead, I work very closely with my colleagues in the NHS. So I work with Duncan Burton, who's the chief nurse. I go to his senior management team meetings every week, so I link into the regional nurses and then through to the ICB nurses and that wider NHS workforce. And then outside of that, very much that kind of interface with other organisations. So obviously the sector itself, providers, those representative bodies, and those professional organisations, people like the Royal College of Nursing, Queen's Institute of Community Nursing, and the Foundation of Nursing Studies. And then more recently been doing some work, have done throughout this role really, with the National Clinical Director for Older People, Tom Downs. So just that kind of matrix working across the system, as well as obviously focusing around social care. And additionally to that, I suppose the Nursing Midwifery Council's been a critical partner, and been working with them as well. So it's and then, you know, and most importantly, then we've got that interface with the Skills for Care. So they are again a really important partner, and we commission work through them. So I work with my colleague Lucy Gillespie there very closely, developing that kind of nursing agenda with her as well.
Social care has always been a passion of yours. So just explain a bit about the background to coming to this role.
Yeah, so my career's traversed, it's quite unusual, it's traversed across both health, social care. I've done an academic post in the past, and I've worked previously within the civil service as the nurse advisor for older people, and I've worked in the independent sector. So I've kind of done a bit of everything, and on the fringes done bits of work when I worked independently for a short while, with charities as well. So I've got a very diverse background. I suppose for me, this takes me back a very long time in my career. So this is probably around 1990. I was working with a professor of older people in Bristol at the time, and I remember we were having one of those kind of in the olden days post ward round kind of cups of tea, and he said to me, if there's one thing you could do for nursing, what would you do? And I remember this conversation, and he's 80 this year actually, and we're still in touch. And I remember sitting there saying, if I'd do something about care homes, or nursing homes as they were known in those days, I'd do something about nurses there. And I don't know why I said it, and then it kind of lay dormant on my to-do list for some time. And then I took some time out a few years later to do my master's degree full time. And to fund that, I did agency nursing at the weekends. So I went to university in the week and did agency night duty. And most of those shifts, nearly all of those shifts, bar about two, were actually in care homes. And what I observed there was some absolutely dreadful care, but some absolutely and mostly brilliant care, and it kind of got my curiosity going about these nurses who work so autonomously but are so poorly recognised for the skills that they have, and the care. I mean, the kind of, you know, the care staff were absolutely amazing, and so that kind of got me going. And then I did some research looking at standardised assessment in long-term care settings, part of an international collaborative. So I think there's been it's a bit like following the crumbs to where I am today. All these moments in my career that actually led me to where I am, and this curiosity. And one of the things I think that drives me personally is If there's always been a job nobody else wanted to do, I always wanted to do it. So, which is why I went to work with people with dementia, because nobody else wanted that job, and why I ended up, work my kind of clinical career around older people, because nobody else wanted to do it back in the 1980s. So I've always been kind of I like a challenge, and I like going places that actually I think are poorly represented when there's great things happening. So I think that's kind of probably where it's led me in all these moments when I look back in my career, never intentionally, but I look back and I think it's led me to where I am today. And I think having that diversity of experience really helps in a role like this at a national level.
Are the challenges different now to when you first got involved with the sector?
I think there's been absolutely exponential improvement. I think that out of adversity comes opportunity, and I think one of the tragedy of the COVID kind of pandemic years is that the focus that came to social care in a negative way in many ways, but actually shone the light on fantastic and brilliant work that was going on. And I think that kind of forcing NHS colleagues to recognise the skills, the opportunities and the work of social care was a really positive thing that came out of it. And I think, look for the gift in the problem. And I think that was definitely the gift. And I think that, I see now the kind of there's a greater sharing amongst the sector. I think we've moved away from that, that's commercially sensitive, I'm not telling them what I'm doing because I don't want them to copy me, to a much more grown up, collegiate kind of cohesion amongst the sector. And I think that's a really positive thing. And I think that, through the Social Care Nurse Advisory Councils we set up, which is a small thing, but actually having that dialogue with those regional NHS nurses and ICB chief nurses is just that constant reminder that that part of the workforce is on their patch and is absolutely vital to the health and social care system.
Does there need to be more cooperation, though, between the NHS and the private care sector?
Absolutely, and I think there's masses of opportunity, and I know some of the work that you've been doing in Lincolnshire. In fact, Duncan Burton and I came and did a visit earlier this year, and thanks to Melanie Weatherall for sorting that out. And we met system wide, so we met colleagues from social care, the provider kind of world, and the NHS in that room, and just hearing the kind of collaboration that's going on. And I know that the work that Melanie's been doing with colleagues locally around the bladder scans and what difference that's making in terms of emission avoidance. And it's that kind of really practical, pragmatic kind of interventions that can stop people going into hospital. We know it's the worst place for people with frailty, and actually ensuring better outcomes for people. That's a great example of brilliant collaboration, and that is so, you can replicate that. That's so easy to replicate across systems. So what we're not good at, I think, and I think the NHS is equally bad at this, is that we're not good at sort of taking the good stuff and then replicating it at scale, and that's how you make a difference. So I think we need, we could do much more of that. There's got to be a way that we can make that happen, that kind of shining the light on excellence and just doing it.
That leads us to talk about the NHS 3 shifts, and we'll talk about those individually. I mean, the first point, which we just touched on there, from hospital into the community. So there has to be the facility in the community, doesn't there?
Yeah, absolutely. And one of the things I describe about social care in terms of the context of neighbourhood health, which is, I think, could be the big focus now in terms of the 10-year plan, is and that that whole shift happening is that social care is an absolute community asset, and we have to capitalise on that. And it's not just about capacity, it's also about capability. So how do we develop our workforce to become, to sit and stand side by side NHS colleagues in that respectful way, recognising the skills and the abilities within those teams, within our social care teams, within our provider landscape, to actually be part of the solution and part of the kind of future and improving the outcomes outcomes for people. That's we kind of collectively look after these people. It's not one or the other. We do this together. We're looking after the same people, so we can do it better and use our assets in a much more effective way, I think.
But it has to be joined up, doesn't it?
Absolutely. And I think that we as a social care, the royal we, I think, have to go and bang on those doors. There will be lots of NHS organisations looking at the 10-year plan now, thinking how they're going to do all this, particularly around that shift bit. I think there'll be some land grabbing going on. I think people think, where can they kind of create opportunities? And I think you just have to force yourself through those doors. And I know in Lincolnshire, you're particularly good at that, and I think it has to be that tenacity and determination to make stuff happen. You can't wait to be invited to the party. I think you just sometimes have to gate crash and make that happen.
Let me just mention the other two aspects: analog to digital, preventing ill health rather than treating illness. I mean, that's nothing new, the last one, is it really? We always say prevention is better than cure, don't we?
Yeah. One of the things I would say about that, if you look again at the workforce in social care, 1.7 million people, bigger than the NHS workforce. That whole opportunity of making every contact matter. So if you think of our domiciliary care workforce going into people's homes, they're not just looking after a person. Often it's that interface with the family and all the dynamics that go on with that. Is there a way? Is there a way that we can capitalise on that and actually give some of those public health messages to our workforce to actually help deliver some of that?
What do you think are the potential opportunities and barriers then for people in the sector?
In the context of what?
In the context of the changes and going forward and working together.
Yeah. I think the barriers are the ones that have existed for a very long time, which is around, and I think it works brilliantly in some places, but people not always recognising that asset of social care. So I think again it's about the sector stepping forward and demonstrating that. So I think that can be a barrier. I think it can be an opportunity to push the doors open a bit. And I'm not saying that this is easy by any stretch of the imagination, but I'm a great believer: you don't ask, you don't get. So you just kind of got to go in there and help be part of that shift rather than stand back and be a victim of it. So I think I really believe we all have more power than we realise, whether or not you choose to use it. So I think we've all got a superpower actually. So I think there's that. I think the opportunities are the NHS don't know how to do some of this stuff. And when you look at acute hospitals, they're very, you go and listen to acute NHS hospital, even where they're integrated, their focus is on the pressures of the acute beds. So they need that help and they need that expertise. So they should be willing to listen. So I think there's both barriers and opportunities within that.
One of the big challenges that the hospitals face is sort of, they use the phrase bed blocking, don't they? Moving patients on. Again, opportunities in the community?
Massive opportunities for that. And I would say that the biggest opportunity is stop people going in inappropriately. So it's how you avoid inappropriate admissions. People are not bed blockers. People are victims of a system that's not working effectively. So let's not blame the patient. Let's sort out the system that sits around it. So for me, it's about how you avoid admission to hospitals. So some of that is exactly the example of the bladder scans. It's about if we develop our workforce, if we develop advanced nurse practitioners within the care sector that are remunerated and recognised for what they do, we can avoid people going to hospital. Nurse prescribing is a real opportunity for that as well. So I think there's things that the system can do if we work collaboratively that can really help admission avoidance.
Finally, are you optimistic about the future?
I would say a glass half full than an empty person. I think there is masses of challenges ahead. There's always been challenges since I started my career. There's always been challenges that we've faced. I think there are real opportunities in neighbourhood health if we do it in a collaborative way, if we do it in a respectful way of actually we're all there for the same benefit and seeking the same outcome for the people that we serve collectively. So I think there's opportunity there. I think the digital agenda is a massive opportunity. We've got to get these systems, digitalisation is, if we'd done this 20 years ago, commissioning would be different. We got real evidence to what we're trying to commission, real evidence about what the kind of skilled work that happens in social care. So I think the digital agenda is massively important, along with the AI agenda. I think that's going to be totally transformative. And I speak as somebody who was shown a computer in the early 90s by a colleague when I was working in an acute hospital, saying that's nothing to do with me, I'm not interested, and now I can't.
It'll never catch on.
I know it'll never catch on, and I'm at home and I've got 6 ways of actually accessing the internet. It's just it's bonkers. So I learned from that, and I now look at AI, seeing that as a massive opportunity for reducing the amount of time we spend doing things that we just don't need to be doing.
Deborah, thank you very much indeed. Appreciate your time. Thank you.
Thank you.
Perfect.
Lovely. All right.
That was lovely. Thank you very much.